Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Tramadol. Its brand name is Ultram. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on this video as it would really help me with the YouTube algorithm. So first off, what will we cover in this presentation? We're going to start by talking about how Tramadol works. We'll discuss indications or reasons we would prescribe this medication to a patient, then contraindications or reasons we would not be able to prescribe Tramadol. We'll talk about examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does Tramadol work? Well, first of all, it's a centrally acting synthetic opioid analgesic. Its effects are caused by binding to the mu-opioid receptor and through weak inhibition of norepinephrine and serotonin reuptake. In terms of indications, or when we would see this medication prescribed to a patient, typically we would see it prescribed when the patient has moderate to severe pain, and we also see it used in the setting of dental pain as well. Now, when would we not be able to give a patient Tramadol? So first off, if they had a hypersensitivity to Tramadol, they would not be able to use this medication. Patients under 12 years of age cannot use Tramadol. It will be contraindicated in patients who have significant respiratory depression in an unmonitored setting. If a patient was intoxicated from alcohol or narcotics, they could not use this medication. It will be contraindicated to be used if a patient have used a monoamine oxidase inhibitor in the previous 14 days. And lastly, if a patient had a known or suspected gastrointestinal obstruction, they would also not be able to use Tramadol. Now for some examples of dosing with Tramadol. So if a patient was using this medication to treat moderate to severe pain, the initial dose for the immediate release formulation would typically be 25 milligrams per day in the morning. They could then increase the dose by 25 milligrams a day, given as a separate dose every 3 days to reach 100 milligrams per day, which would be given as 25 milligrams 4 times daily. For maintenance therapy, again with the immediate release formulation, they would typically use 50 to 100 milligrams orally every 4 to 6 hours as needed. The maximum dose would be 400 milligrams per day. This would be given in divided doses. In the setting of dental pain, a patient would typically use 50 to 100 milligrams as a single dose. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Tramadol or Ultram, so we'll go over some of those here now. 13 to 40% of patients may experience nausea, while 10 to 46% of patients may experience constipation. Vomiting may happen between 3 and 17% of the time, and 7 to 33% of patients may experience dizziness. A headache comes in at a rate of 3 to 32%, and somnolence comes in between 4 and 25%. 8 to 16% of patients may experience flushing, and 3 to 12% may experience pruritus or itchiness. Xerostomia, or dry mouth, may happen up to 10% of the time, and up to 11% of patients may experience insomnia. Now, some more rare but serious side effects with Tramadol would be difficulty breathing, an allergic reaction, or respiratory depression. That's all we're going to talk about today with Tramadol or Ultram. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information to be valuable and you'd like to help grow this channel, remember that you can leave a like on the video or subscribe to the YouTube channel. There's also some links in the description you can check out as well. For today, take care.